When you look at our staff, and you look at our board members, and you look at our management team, they all care tremendously about what happens in the community. People that come to AxessPointe get coordinated care that's unavailable in a lot of places. So I like to call it one-stop shopping. They can come for medical, dental, women's health, pharmacy, behavioral health. It's an opportunity to get your care all in one place. We need to serve those people in the best way we can.
So our goals as an organization is making sure we meet the needs of our patients, making sure that when you talk about things like diabetes or hypertension or obesity, that we can play a critical role at making sure that patients are feeling better, they're living longer and sustainable lives.
I chose and I love AxessPointe because patients can get high quality, affordable, accessible care here from a group of people that really care about their patients and really care about their community. I've seen individuals transform their view of healthcare from being inaccessible and expensive to one that is affordable and a partnership.
A lot of the patients coming on the dental side, they're usually scared. And for me, it's like a challenge. My challenge is trying to actually get that patient after that actually leave out of here with a smile and comfortable. I feel like I'm one of them, and I want to actually treat them like I actually like myself to be treated.
Just the kind of patient population that we serve, the ones that are not insured or underinsured, they deserve a right to have adequate health care. And even if I'm able to make that difference in one patient, that makes it all worthwhile.
AxessPointe provide healthcare to everyone in the community, regardless of their income or social background. Everyone gets the same high quality care. When I am able to make them happy, it makes me feel very happy.
So what the 340B pharmacy is, the government ensures that we get reduced rates for our medications. That way we can pass on these savings to patients that are uninsured. So for me, that's a really amazing thing, because having a patient tell you that they haven't been able to get their medications because they haven't been able to afford them just really gives you a really satisfied feeling.
There are about 20,000 Nepali speaking people here, and they don't have really good English. I do a lot of outreach in the community, mostly focusing in Nepali, and go down to the community and do outreach, speaking in Nepali, translating them, helping in numbers of ways that they need.
I decided to come work for a federally qualified community health center because I enjoy being involved in the community, making sure that I'm meeting a need. The population that we work with in the FQHC are very appreciative. They value the relationships that are built. It's interesting to learn about what's happening in the community, but also be able to make a difference.
Sometimes patients have a bad day. They come in, they need a little something, we give it to them. We've all been in difficult situations, and it's good to just see a little piece of yourself in somebody. It makes it easier to help them, to empathize, to get them in a better place. That's what makes me want to keep doing it, so that whatever their struggle is, I can do my part to make it less of a struggle.
There was a time in my life where I was on Medicaid, and I remember going to the doctor's offices being treated like a second-class citizen, people not looking at me or listening to me. So the fact that I've been afforded the opportunity to make a difference in individuals' lives, I love it. So it is my job to ensure that our workforce is treating everybody with compassion and love and kindness as they navigate through our system. To provide a quality,
affordable,
and compassionate
health home to every
patient,
every time,
in all communities.